Hi, Christine. This is my response to your discussion post. So, I read your post and I also read the World Health Organization Mental Health Policy Plans and Programs resource. And I felt like many of the reasons that were listed as barriers to developing mental health policies, I thought they were kind of intertwined, such as where mental health authorities don't feel that mental health interventions are effective, therefore, they redirect their funding towards what they feel are more important health priorities, such as communicable diseases such as HIV, tuberculosis, yellow fever, which is real serious in some African countries, and most recently, COVID 19, which, that's been a major health concern globally. And then there are other healthcare concerns such as maternal health and reproductive health care. But what policymakers seem to disregard is that healthcare concerns and mental health are related. You mentioned how physical health conditions can be exacerbated by mental health, and according to Patel et al., mental health problems such as depression, anxiety, alcohol, and drug abuse, they're among the most common and disabling mental health conditions globally, and they often co occur with acute and chronic medical problems. And without treatment of these mental health conditions, it can actually contribute to non adherence of medications for medical conditions and eventually increase healthcare costs when the conditions worsen. Gathering data such as administering like the PHQ-9 in a primary care setting, I think that'll help to determine if those receiving treatment for medical conditions might also be suffering from a mental health issue. And this data can actually be presented to health authorities to demonstrate that there is a need to integrate mental health services in the primary care setting, which is actually cost effective. Patel et al. Also addresses the advantages of treating mental health care in primary care settings in that it's patient centered and it treats the whole patient. And it also eliminates the stigma surrounding mental health in that the patient's not going to a separate mental health clearing clinic, and having this fear of being stigmatized. So ultimately, the conclusion that you came to, in which equal attention should be given to both physical and mental health, is accurate, and it can be achieved through integration to avoid competing against